This segment coming up is brought to you by Paws Veterinary Center, a transformative veterinary practice, integrative medicine, located here in Tucson. We do telemedicine cases and help out all over the world. You can reach Paws at 520-888-7297 or check out their website at www.pawstucson.com. And also remind all of our listeners that any questions on any of this, feel free to reach out to me at Randy at drrandypetvet.com or our website, drrandypetvet.com. We'd be glad to follow up with questions and answers, and anything that I can fend off to Brandon. I know he'll help us with too. So welcome back for section 2. We've been talking about biome, its effect on our dogs and cats, things that what it is, what we can do. Now we're going to delve into, we'll talk a little bit more about some disease conditions if we could, Brandon, and wherever else you would like to go with your slide deck too, if you have some other information you want to add to what we were talking about.
Yeah, absolutely. So in regards to disease states, we always kind of first think our first instance is utilizing it for GI. And I think, it's a new technology, being able to utilize real native microbes, but in actuality, it's actually not. Let me pull up a slide real quick that's pretty interesting. Sure. When we start talking about utilizing microbiome medicine, this is kind of neat. So let me see here. So kind of going over this, this is something that I always ask my practices when we start kind of going through and doing some lunch and learns and things like that. But I always find it interesting when people are thinking about this because, I talk about next-gen sequencing and this crazy new technology that's occurring and all that kind of stuff. So it's always kind of puts people on their toes when I go over this question. And the question is, when do you think the first microbiome medicine was first documented as a therapy for our common GI conditions? And the answer is pretty astounding. It's the 4th century.
Wow.
The 4th century.
Wow. Yeah.
Yeah, so the first documented case, was China in the 4th century, and they created what was called yellow soup.
Yeah.
And what essentially it was a slurry of native microbes from humans, healthy humans, that they fed to the GI patients. And the thing is it fixed them. It worked.
God bless the Chinese.
And so we talk about, yeah, right, it has to be. Yeah.
Yeah.
That's Eastern medicine at its finest.
Yeah.
But certainly, we talk about this as a new front, and it is to a certain degree because we understand it better. But it's been a practice for a very long time, and so, something to think about when we start talking about this sort of thing is, what else can we do with it? How else can we kind of help these imbalances and different solutions? And so, with the testing and everything else, we can definitively find different types and common problems that we see within microbiome medicine. And so one of the ones is pretty obvious. You have an overgrowth of harmful microbes. And that harmful microbes, the current standard protocol, if you're not, utilizing that sort of stuff, the veterinary practice has always been to utilize broad spectrum antibiotics. We have pathogenic bacteria, we got to get rid of them. We're just going to wipe it out. Well, we'll get into kind of why that's a problem, but the main instance of utilizing broad spectrum antibiotics every single time is that it doesn't just take out the bad bugs. It takes out the good ones too. And we have to be able to put those back in. The other one that we see a lot of when we've ran all these tests is that we're missing key beneficial microbes. So one of the things that we talk about with regards to kind of probiotics versus our kind of natural, the FMT aspect, is that there's nothing wrong with standard probiotics. I want to be clear on that. It doesn't harm our patients at all. But that being said, what we have found in research is that a standard probiotic isn't typically derived from that same host. Meaning, if you're giving a standard probiotic, that strain of bacteria wasn't made from a dog or wasn't made from a cat. And why is that important? Well, it's actually really important as it turns out, because that bacteria has to engraft into that GI tract. It has to be able to sit there and stay and grow. And if you're giving human strained or soil-based strained, lacto-based strained probiotics, those same engraftment sites, they don't fit like that key and hole kind of analogy that you would typically kind of see. And so we'll talk about that kind of more and understanding that aspect. But before that, the last one is really kind of a skin issues that we saw. And we saw in that previous test that I showed prior. And that's where we have a diverse microbiome. So there are plenty of diversification there, but they're not in that typical abundance that we'd see in that healthy reference range. And, there really wasn't a common solution for that before we kind of had next-gen sequencing. And so that's kind of the start of it. I can jump into antibiotic usage if you want, or we can talk more about disease states. Let me know kind of where you want to go.
I think we can go to antibiotic usage, but I'd like to comment a little bit about that before you start. So
please,
if you could bring that up, and then we could talk. So
yeah,
I went to another seminar that I attended not long ago. Was a gentleman who is head of microbiome research at the veterinary school at Texas A&M. Now, Texas A&M, as many of veterinarians know, is really the bastion of gastrointestinal disease. Their GI lab has been just at the forefront of so many different things. And it was really fascinating to me because, again, I was in this room of 100 veterinarians from Phoenix and Scottsdale and Tucson, all over Arizona, a few from actually California. And he asked the question when he was presenting, how many people basically look at the biome or do fecal microbiome testing, we call it FMT, or therapy with this? And I really got embarrassed, Brandon, because I raised my hand and I actually wanted to look around to see who else was there. Nobody else put their hand up. And so, I'm not bragging. What I'm saying is that I'm so happy that I'm able to incorporate this, and we want to train veterinarians to understand the importance of this. But getting to this antibiotic thing, here's where people really go wrong. And so, every GI case that I know of in the last 5 years that I have seen that have gone to an emergency service for bloody diarrhea, acute vomiting, severe stool problems have been put on antibiotics. Either the two that you're mentioning here, which is tylosin or metronidazole. And this is a real problem. His comment at that seminar was, unless that dog or cat has a fever, you do not use these antibiotics. You do not have to use these antibiotics because what Brandon and I are talking about, we can treat this very effectively without these. And the complications, in fact, I think there was recently a paper that just came out about metronidazole and its long-term effects on the body for dogs. And it's staggering. So please, whoever's listening to this, understand that there are other ways. So Brandon, I'm going to turn it over to you to talk about this a little bit more, if you could.
Yeah, no, absolutely. I mean, there's been plenty of studies that we see in regards to relapse rates. And when I talk about relapse rates, we're saying went ahead and administered the antibiotics, and then in a certain amount of time frame after that episode relapses, it occurs again. So they see more clinical symptoms occurring. And we see this probably more significantly now than ever before. And there's a couple of reasons for that. One of the things to note is that, bacteria may not be smart, but they're really good at evolving. And so what they'll end up doing is they will end up being able to not be susceptible to certain bacteria, to certain antibiotics. And you'll see that they will actually be resistant towards antibiotics. And we've heard about this sort of thing before. That's why, we don't see us using PIN-G when we used to use it all the time back in practice, and vice versa, right? It doesn't work. It doesn't work. And there's a reason for that, because if we use it all the darn time, then all of a sudden more and more bacteria, the ones that do live, they're going to be immune to that antibiotic. And that's going to perpetuate. And then those are going to grow. And then you're going to have a whole entire resistant strain of bacteria that's not susceptible to that. And perfect point. And I love the Texas A&M reference because I have a Texas A&M study next. And this really delves into, I don't want to get too into the weeds, but I want you to kind of see when we're talking about pathogenic resistant, meaning certain bacteria that when you give them antibiotics, it doesn't do anything. This is a perfect example here on this chart. So these dogs, put them in two groups. The black group, the line here is metronidazole, so they were administered metronidazole, and the red line was administered FMT, that fecal microbial transplantation. And they were administered for it for 7 days. And we see here, this is looking at E. coli. And so, as you see, even though metronidazole was administered, E. coli goes right up. Now, E. coli is
Yeah.
naturally found in the gut. Without question, it is, but at small, manageable levels. When it gets higher, that's when we start to see these clinical symptoms. And more interesting, because they normally live in the gut, when they're off of the antibiotics on day 7, that E. coli doesn't go back down. Why should it? It has no reason to go back down because it's normally found in the body. This sort of thing is the problem and kind of where we're at. Now, there have been plenty of studies looking at humans as well, showing instances of children with earaches or chronic ear infections being administered broad spectrum antibiotics, and they are 30 to 60% more susceptible to Crohn's colitis at the age of 30. And
Wow.
so this
Wow.
sort of thing is just, it's really coming to fruition. We're really starting to have that. One of the conferences that I'm going to be going to and speaking at is over at ACVIM, and that's our internal medicine specialty conference. Dr. Aronson knows, but letting the viewers know.
Right. Right.
And one of the things that they have put together is a microbiome consortium. Now, that's pretty incredible. That's pretty great news. I mean, to have the internal medicine specialist, which is kind of our, they're the ones who make the rules, so to speak, or they're the ones that are coming up with the new information and resources. They're the ones who are saying, we need to look into antimicrobial stewardship. It's important. And not only that, we want to have a consortium, a group of individuals that can really focus on microbiome medicine, bringing this to fruition within
Yeah.
regards to Western medicine and that kind of approach.
It's fabulous.
So
One thing I want
it's
to
great to
show.
see.
Yeah, I want to show the listeners on your chart, which is very important on a predictive index, is if you look at the left chart, which is the dysbiosis index. So anytime dysbiosis index goes above 0, it makes it way, way more difficult to get that condition into check. In fact, you can actually almost grade a severity of disease by that index. And if you notice that with the red line, the FMT animals, that index drops and stays dropped. With the E. coli, it goes up and stays up. And so that means that further along down the line, that dog is going to have more and more issues because of that index. We often know that by the dysbiosis index, maybe sometimes how often we have to do FMT or repeat it. And he actually showed in this seminar that multiple FMT procedures using what's called a freeze-dried slurry of these beneficial bacteria, microbes, can really be repeated at multiple times. Even in severe cancer cases, there's a cancer that causes small bowel lymphoma in cats. It's becoming very common for us to see this.
Yeah.
And those cats gain weight, they feel better, and they're doing FMT treatments at Texas A&M almost weekly for a few weeks just to get those cats back. So fascinating stuff, Brandon. Thanks for that. Appreciate it.
Yeah, absolutely. Yeah, we have a couple of specialty oncologists as well, board certified oncologists, and they utilize our FMT fecal material for actually doing GI lymphoma patients every day
Yeah, yeah, it's a great way to go.
with great success. Yeah,
Yeah,
so it really is kind of changing the way we kind of look at it, and hopefully the plan is, to be able to have an actual standardized format to be able to kind of
sure,
utilize this at the practice.
sure. And that's kind of someplace that I want to go to next. So interestingly enough, I want to mention to our listeners also, Animal Biome has a fecal microbiome transfer capsule. It's a freeze dried product that we use, and it's available for dogs and cats. And it's a great way to go. We don't just have to do an enema basically to give the FMT procedure. We kind of do those, but we reserve those for different cases, like a cat that won't take a capsule, let's say, or a very severe bowel problem that we want to really get on top of quickly. The first FMT capsules I just saw produced for humans, the price tag on one treatment, $17,500. So you might want to let your biome people know that whatever we're doing on our capsules, we are really saving a lot of people some money, because it's nowhere near that cost. It would never be that cost.
Yeah,
So just so you know, it's a
yeah,
fascinating thing.
I believe that. I mean, I think I don't remember which university. I believe it was Stanford. I'll have to double check it. They have an entire donor program and selection process, and it's absolutely incredible, their donor kind of program to collect the FMT. You know, they have to rate these people on healthy scores, and they have blood
Sure.
work, and for that, that's exactly what we did. We basically took over their protocol and utilized it for veterinary medicine. And so our headquarters is up in Oakland, California. We have kind of this, I'll share this screen with you, kind of make it easier to kind of understand
Sure.
everything. I think it makes it um, easier to talk about and show. So we really kind of have almost essentially like an Uber pickup for this donor
Right.
collection. And they
Right.
will go every day in their cars and go to these different donors. Now, the donor selection process is pretty extensive. I mean, we do pathogen testing, parasite testing. It takes about 3 to 6 months to get into the program. Then they go through, you know, we have blood, we have 3 years of clinical history, no antibiotic administration, making sure their diet is nutritionally balanced, and also making sure that those healthy microbes are in the stool samples so that we can definitively say, this is clean. This is on
Yeah.
our healthy reference set. These have all the good things that you need. After all that's done, it then goes and we freeze dry it so that it's kind of preserved and put in that state. And then it's put in those capsules. Now, it's not enough just to put them in the darn capsules, because that those juices in the gut, that
Yeah.
acidity just eats up everything.
Right.
And so we had to create these like enteric coated capsule so that it can
Right.
bypass those gastric juices in the gut and then get distributed into the small, large intestine. And
Yeah.
that's really the difference there between kind of, you know, utilizing probiotics, which, like I said, they aren't bad at all, but these are real native microbes, and native microbes, host specific microbes, make a difference. They really, really
Yeah.
do.
And I'll mention that the Animal Biome line has a number of other products that I utilize, and other veterinarians utilize, Saccharomyces, which is a beneficial yeast that really, really helps our pets. And there are specific products for like overpopulation of E. coli. And so there's ways that we can address this, and this comes back from the report that we get from Animal Biome. And I share all of these reports with our clients. They know everything that's going on, and they're
I love
fascinated. I
that.
mean, they really are.
Yeah, I mean, I think, you know, as we get further and further along in regards to research and understanding, we will be able to really create this gut microbiome test for a preventative health model, because that's the end goal. I mean, let's be honest, if I could have a test at my practice and be able to say, hey, everything looks good on Fluffy, let's go ahead and do this microbiome test, this yearly test. We'll go ahead and take a look at that and see kind of what's going on. And I have markers that show that there's inflammation that's going up, or if I have pathogenic bacteria that's a little bit higher than I'd like, I promise you that if we can be able to change that then before we're in that complete kind of inflammatory response where we are clinical, it changes so
Yeah,
much faster.
yeah,
And it's not always, you know, necessary for us. It can also be a diet issue. And I think, yes, my animal biome is very instrumental in helping with microbiome medicine. But without question, if you are not addressing nutrition, you're not going to get long-term health. You're
that's
not.
right. That's right. And we talked about this on our podcast many times about removing the inflammatory things in our pet's diet, making sure that they aren't sensitive to certain things. We talked about that NutriScan testing, making sure that they have the right types of products to support their health. And as I mentioned earlier, very early in the conversation we had, I'm moving towards the wellness part of this aspect of doing this. I'll give you some examples. We see a lot of puppies when we do our puppy plan that we do fecals on, and we're finding a pretty large amount of Giardia and a fair amount of Cryptosporidium, which could be what we call pathogenic or dangerous for people who are immune compromised. Now, on the testing, it actually shows that they're not shedding these, they're not seeing them in the actual fecal sample, meaning when they look at what's called a flotation, but they're finding these on these PCR tests. So the way I address
Which
this
means they're
is
not shedding yet.
Right, exactly. The yet is the important thing. Thank you. But what I do with these dogs is I don't put them on antibiotics. I don't treat the Giardia or the Cryptosporidium immediately. What I do is AnimalBiome. And we have found that by doing that and balancing them, these tests correct back to normal, and they're now able to have enough of a healthy immune system to fight these things off naturally without changing the whole flora by treating with febendazole or an antibiotic, that type of thing. So it's really been great. But as Brandon alluded to, my goal is to start these guys off early with AnimalBiome fecal test, making sure that everybody's balanced, that we're in good shape, because then we could head off potentially the potential skin allergy, the potential GI disease, the potential behavioral problems, and God forbid cancer. We may be able to get on top of this a little bit.
Yeah, I mean, I think certainly we are looking in other interests in other areas. I think the GI tract is that first instance, but I can tell you, just to kind of shed some light onto some new instances, we're
Yeah,
looking at the blood, and the blood is such a clear picture of what's going on in that body. Because in the very beginning, we thought blood was pretty darn sterile. I mean, yes, of course, you're going to have your proteins, things like that. It has to get all the nutrients in there, but not really pathogenic bacteria. I mean, apart from sepsis and things of that nature.
sure.
But as it turns out, we just finished up our paper that was just published over at Veterinary Sciences, and what we found is pretty remarkable. It seems as though that there is actually what we call translocated events, and what that means. Dr. Aronson was talking about leaky gut, right? And so, in a very easy sense of the word, leaky gut, think of it as you have these cells, and then all of a sudden they're tight, and then they become a little bit looser, leaky, and then you're going to have other particles and things of that nature that go through that barrier. Now, why is that bad? Well, the blood's there because that's what's digesting all the food. And so if that bacteria gets into the blood, it can cause a lot of different things. And what we're finding is pretty remarkable. From a healthy individual to a clinical GI symptomatic patient, what we're finding is that there is more bacteria in the blood in a sick patient than in a healthy patient. And that kind of
Wow.
makes sense.
Sure.
But even more important is that there is bacteria that is in the gut that you can actually look at on a sick patient, and that same bacteria is found in the bloodstream where you have this translocated events where you can see where this one hearts, where this
Yeah, I
one
love
came
that.
into this one actually, these bacteria from the gut actually moved into the bloodstream, and you can track that strain and draw a line to it essentially because you can see that evolutionary path. And so we are really showing that it's not just harmful, it's also beneficial, but these bacteria are crossing this membrane, going from the gut into the blood. Well, now if we have blood in the back if we have bacteria in the blood, where can that go? Well, it can cross the entire body. Now it can get into all
Yes.
these organ systems. So
Yes.
now we can have liver issues, we can have kidney issues. We talk about the gut brain axis going through the blood brain barrier. All of this now can make actual sense to why it all starts in the gut.
Yeah, makes
And I
sense.
think that there's
Wow.
really something to that.
Yeah, that's exciting, upcoming. And also, maybe mention a little bit about other things that you guys are working on. Maybe you might want to mention oral biome. I don't know if there's anything going on with skin biome. Whatever you're working on would be really fascinating as we conclude this conversation. That would be great to know.
Yeah, absolutely. I mean, I think I think that there is definite use case in regards to skin microbiomes. And we have been avidly looking into that. We are coming out with a test for skin microbiomes in the near future. It allows us to be able to take a look at things. At the veterinary practice, there's so much that we can do. We can do our skin scrapings, we can do our fungal cultures. The problem with fungal cultures is they take so darn long to
Yeah,
get those results back, or they're inconclusive, and you're like, all right, I waited 2 weeks for nothing.
yeah, yeah,
And
exactly.
so, if what's neat about next gen sequencing is that yes, it can take 10 days or so, but you actually definitively see what's in there. And so, we're going to have a skin test that it's going to allow us to be able to look at that and look at those lesions and be able to actually sample that at the practice or put into that a hair sample. The other thing that I really want to look at with regards to ears, I mean, how many chronic ear infections in our Cocker Spaniels have you
Oh my
seen in
God.
your time?
Yes, yes, yeah.
Yeah,
But I will,
and
but I
and
will mention, that working on that GI tract is the best mode right now that I have to have them not recur. We have seen dogs
absolutely.
3 and 4 times, and then we get the biome test done, we correct what's going on, and these dogs don't have a problem anymore. God, what a surprise. They're not having the
Yeah.
yeast infections and the bacterial infections in those ears.
Yeah, we really have seen a dramatic reduction in impuritis, in itching in dogs and cats when utilizing FMT. I mean, there is a really neat study here. Before we have to head out, I'll just quickly kind of show
Sure,
this one. This is one of my
sure.
favorite studies. This was looking at utilizing FMT. Now, he did extensive screening prior to this study. This is Dr. Ural. And what he really wanted to look at was just canine atopy. So he took allergens out, making sure that that wasn't an issue. He did blood testing beforehand. He put them on a hydrolyzed diet 2 months prior.
Right, right.
And if they were unresponsive, then put them into the study.
Okay,
And he found that every single one of his patients, there wasn't very many of them at that point because he had lowered them down to that, but about
sure.
9 of these individuals, every single one of them on that pruritus scale went down a depreciable
Yep,
level. Not only
yep.
that, but we see here like day 0 and day 28, all of their signs clinically were improved or completely gone and rectified.
Yeah,
They followed up with them for 18 months after. None of them had a recurrent skin issue, and they were able to
which
eat
is
whatever they
amazing.
wanted.
Yeah, amazing. And this bull terrier and now this boxer that you're showing pictures of is exactly what I'm talking about with that case that we had. That
Right?
initial picture on that bull terrier is what this dog looked like. Had ulcerated, bloody lesions. It was scratching itself incessantly, and certainly turned around for with just what you're talking about. Very impressive.
Yeah. Yeah, and I mean, I think that's this is where veterinary medicine needs to go. This is where all medicine
Yep.
needs to go, is
Yeah.
understanding what we can do in order to make the body function properly. Because
Yep.
yes, we can, the the problem with the difficulty with veterinary medicine is that they don't talk to us, right? I've always wanted to be like, what's wrong with you? Tell me what hurts.
Right.
But they
Right.
never do. They never
No.
do.
No, hasn't
And so
happened
we
in
have to
40.
have
Hasn't happened in
diagnostics.
43 years of my practice, and I don't think it's going to happen before I'm done. Quite honestly.
That's right. That's right. And so you have to use diagnostics. You have to use diagnostics. That is what talks to you. And uh, without that, it makes it very, very difficult. And we're playing a guessing game and kind of the shotgun approach. And I think we can move past that. I think that now we can definitively kind of at least have a starting point to that treatment plan. And is it going to work every time? You and I both know it's not going to work every time,
Right.
but it does a heck of a lot better than what I've been able to utilize normally and be able
No
to treat.
question. No question. Brandon, I can't thank you enough. Is there anything else that, in closing, that you want to say at all that you don't think we've covered, or anything our listeners need to know?
I think we did pretty good for round one. I
Yeah,
really appreciate the time,
yeah,
definitely that
God.
you did, and thank you for the invite. This has been great. I really enjoyed it.
Well, always fabulous. Will you give our listeners your website so they can look for contact information, and then I'll repeat mine so they can send any questions along they may have after they listen to this.
Yeah, absolutely. Our website is animalbiome.com. That will be for kind of all of you guys to be able to take a look at. There is tons of information on there as well. You can kind of get your first test going. You can share those tests with your veterinarian. We also have a veterinary division, which is the division that I run. And so we kind of help our veterinarians get on board and stuff like that. But we do have products, of course, for individuals like you where you can share them with Dr. Aronson and do those reports with him as well. And um, probably would charge a fee. I would charge a fee if it was mine,
Yeah,
but
yeah. We
but
try to keep
I'm
we try to
just
keep it very very reasonable because therapy, there's expense in therapy and stuff like that too. But yeah, and it again, I can't thank you and Holly and Tanya and Robin and all the people that I deal with from Animal Biome. They're a great group of people, and they have our pets' best interest, and that's really where this is at. I mean, so please, if you have any further questions on any of this, email me at drrandypetvet.com. Go to my website. This will be posted on every one of the podcast forums. We were on Spotify and Apple Podcasts and all those places. It'll be on there. And hopefully we can do more with Brandon in the future and have him come back. If you don't mind, that would be fabulous. But we're going to keep on
I'd absolutely love to.
poking along and making our animals well. And by doing that, we're going to make you well as our pet parents. So that's the goal. Thanks, Brandon. You were great, man. I really appreciate it.
Absolutely.